My name's Veronica. I'm a co-owner of Essex Physical Therapy. My primary scope of practice is in the aquatic medium. This is Shelly. She injured her right shoulder a year ago playing basketball, and subsequently had a labral repair in October, mid-October, and they also did a distal clavicle excision at that time, but subsequently developed an onset of frozen shoulder and just didn't progress her range of motion as quickly as they had hoped. So she was referred to our office and was seen for an evaluation initially on land, and was just so stiff and tense with range of motion and had pretty significant limitations that we got her into the pool. And that really seemed to help her be much less guarded and work through her range of motion and make some nice gains. Her injury was a year ago and her surgery wasn't until October. And then her first aquatic visit, the following week, December 5th. So ideally, would have been great to get her in sooner. Her program, we started just with no extra resistance, with some general range of motion at 90 degrees, but I'll show you mostly with the added resistance because that's where she's at for now. So it's the same exercises, just without the little added tools. If I look back to my notes, her very first visit, she said that her subjective comment was, "It's so much easier in the water." So I mean, the water has been key. And typically our practice, any patient that we see now with a shoulder injury is in the pool as quick as possible because it just prevents all of the compensatory strategies that people learn to get by with, to function. So in the pool, they tend to not compensate because that buoyancy of the water just facilitates and aids with that range of motion. Easy. Range of motion has improved significantly. Pain levels are better. She can tolerate land exercise now. She started to shoot a basketball. You have swung your golf club. She swung her golf club. One other thing that we had done in the beginning too was just some noodle push downs in the front and at the side. You want to just show a couple of those? And those are really very easy for her at this point, but it's just a good beginning exercise too. We also, her first couple sessions, we did do a little bit of walking on the treadmill the first 1 or 2 times just to work on some arm swing, but that she quickly advanced past that. So just getting the gait back, getting the swing. Not compensating, for a lot of people, not so much in her case, but people tend to really guard that arm and hold it up close to their body. So it works well just to work on some swing. So in the beginning, many times that noodle offers a lot of resistance to people, especially when you're using it just on the involved arm for up and down. Oh, I know what else to do, Shelly, behind you, with 2 hands behind. Gets a little internal rotation stretch again, too. It's the beauty of the pool. You get a good workout to all the other muscle groups too, not just that shoulder. Legs have to stabilize you and the stomach muscles. So those are just aqua fins. Yep, so just start with... This is more strengthening. And just having her focus too on her scapular movement and trying to make sure both sides are equal has been a big key. When we first started, she definitely did more substitution, a lot of shoulder elevation. So she's improved quite a bit from the first visit. Really keep that elbow at your side. This one's tough. This is just trying to work on external rotation, and as you can see, she tends to let that elbow come away from her side. And then Shelly, you can switch to those diagonals. Just really coming down to that. Try to really actually come down to your opposite hip. And then these were the ones where we added your head to turn with your arm, just to get some cervical range of motion in too, because so many times the upper trap and levator gets tight. Doesn't really turn the head this way too. Like when you're down, turn your head all the way. There you go. Good, and then try the opposite too. So when your arm's out here, there you go. Just getting opposite neck motion, stretching those muscles. All right, that's, well, I know, we did the 8s too, figure 8s. Good. All right, so why don't you take those off, do that little stretch this way. So just to stretch into internal rotation, adding that hydrophilic cuff just adds that little bit of buoyancy. So just try to stretch it back there, Shelley, and hold it. To be so careful for compensation. I mean, people tend to really like flex their wrist or extend. And now, when we first started, I think she could barely get to your butt. Yeah, so that's really some nice progress. Yep, grab a noodle. And we'll have you just first do like the snow angels. Up over your head. So just some supine floating to work on. Oh, she's going to lock her feet in the side so she stays still. That helps. So just to work on some ab and adduction. And again, just focus on, lots of times too, I'll get in the pool with somebody and just feel their scapula to give them that feedback of how those are moving. So just working on the symmetry of that. I would say if somebody has a shoulder injury and gets in the pool, if they don't want to get their hair wet, they aren't going to reap the full benefit of the pool. And same thing with if they're willing to learn to use the snorkel and mask, it makes a tremendous difference in their progress. Because as you can see, if you work just in standing, you pretty much can get to 90 degrees, and that's it. The other one were those clocks. So if you start down here, just get those shoulder blades. So you're just kind of pushing down. Just working on, again, just some scapular strengthening. So it's just, I call it a supine clock exercise. If you start with your arms down at like a 6 o'clock hour and just work on pushing down into the water, it gets the scapular muscles engaged again. And then work your way up to the 5 and 7 o'clock and do the same thing. And it gets progressively harder as you work up to 3 and 9 and then way up to overhead. Repetition, people tend to fatigue with this a little more quickly. The other thing, let's see if I can get these. So the bells just add a little extra level of resistance too. So Shelley, with these, just keep those palms up. And it's just that same, actually think of pushing the bells right down to the bottom of the pool. Not literally, but that's the motion. So that just adds that extra bit of resistance. And again, with that, you can start at that 6 o'clock with your hands down and just progressively work on going up. And it definitely is much harder the higher up you go. And it just gets those middle traps, lower traps, rhomboids. See, and you can see definitely with her right arm, it doesn't go quite as well as the left. All right, why don't we do that mask and snorkel? So actually, before I would show anybody the mask and snorkel too, usually we go over, I would start them first with the mask and snorkel on and just doing a little bit of squatting to get used to the breathing if they haven't done that before. Also work with them on how to get back up once they're in this lying down position, because sometimes people get in that panic mode. Many times I'd be in the pool with them the first time that they did this. So what she's starting with now is just a little bit of stretching. Just slow that up a little. Yeah, there you go. So just kind of pulling in for a little rest and then stretching out, hanging on to the side of the pool. Shelley, you can hold it a little more. Yeah, stretch right out there and hold it. And again with this, the snorkel and mask just puts the neck in such a much better position and alignment. If she were lying like that, and her neck would be really almost hyperextended. She can say, that's a great great stretch. She was not able to, like, to tolerate any of this on land was just almost impossible. Just from a pain standpoint, she got in the pool and was really able to move. All right, and then, well, we also did, we were kind of held down this way, and then you can also stretch with the hand and a little more external rotation to get a little combination of external rotation and flexion stretch in that same position. So yeah, if you want to turn around and just hook your feet in there, and then range of motion wise, the snorkel mask is another great way to work over 90 degrees. So just working on, start with that flexion, yep, so coming up, and then the snow angel type of movement. Just changes that stretch of the shoulder again. So here's just getting a little more external rotation. Also, again, just working a little more middle trap. As you can see, it's a little harder for her to get up to 90 degrees because of the lack of external rotation. You can do a nice stretch here too, again with that HydroFit cuff for external rotation. So just getting into that position and holding the cuff. Just letting the buoyancy pull, yes. Again, in this position, lots of times people need cueing to just make sure to stay looking down at the bottom of the pool. If you start looking up, again, your neck just goes into that extension position. But to me, this is the way the majority of the patients that I treat with shoulder problems have made the best progress. The other one I was going to do was the barbell, those push downs with that barbell. So just do the straight push downs, like right at chest level, and then you can also do the stretch where you bring it up overhead and pull down. In this, you might start with just a noodle, a little less resistance. And many times people will really feel the difference in their involved side doesn't have as much control. So it just really works great for progression of control of that. And it's been nice to be able to get your feet to lock right in there, because then people can just focus on true shoulder movement versus moving all over the pool. So again, with the all the range of motion that we did, we showed that with no extra resistance, but you can progress to using the gloves, the aquafins, you can use the hydrotone bells or the barbells, all for extra resistance. Let's just show that rotation stretch too, Shelley, with the mask and snorkel. So just taking this again and laying down kind of in this position. Not so much back, but more if you're here, remember just coming out into this position. So you get that stretch into the rotation. And then you can, come up into the internal rotation too. And then just, try to bend that elbow a little bit more. There you go. So that's that external rotation stretch. And then in the beginning, you may have to get in to just help stabilize that shoulder a little bit, just because of the way, like, especially for her, her injury was over a year ago, so all that learned compensatory strategies, like, she's really unlearned a lot of those by being in the pool. I think that's the piece that I find the most, is that people get in and they can really not compensate as much because of the, they're usually such much less pain. And then she tries to get into that internal rotation, which is, again, that's just such improvement for her. Make sure that hand stays, yes, because what people will do is just that. They'll cheat with their wrist because they feel like they're getting more motion. And someone like her, I believe it was this side that she had some carpal tunnel surgery on, so you want to be especially careful. Started using the jets for a little more resistance to just some push-pull work. The other two was just that push down and pull up too now. And then just show you if that's easy. Remember, the faster you go, the more resistance you get on the push down and pull up. And then that other, do you remember that rotation one? So you just pull the board here, rotate, and then just extend that back arm out, rotate, and just rotate all the way around. There you go, and then switch. You can also use a kickboard for these exercises too. You can try those rotation ones too, Shelley, with the elbow locked right at your side. Remember the, yeah, it's not there, but try to keep that elbow right in. There you go. The other one too is to loop it through there and hold with two hands, and I think you did two-handed pullbacks. Well, here the pullbacks is just more scapular. Well, and you could, when you do the dumbbells, like the push-pull, you still on the pullback, you definitely get that whole scapular motion too, strengthening. And we do have her. So Shelley, go ahead and turn around, and then we did pull forwards too. So just really too getting those muscle groups working in all different directions. Good. Just a little more protraction, retraction motion again. So just really keep that elbow straight on those, Shelley. So it's just all the movements really coming from that shoulder and shoulder blade, especially on that pull back. There you go. The tendency is to want, because it gets so tight, the tendency is to want to bend that elbow again for making you feel like you're moving more. This exercise is usually really hard for people. The next piece is to turn palm up so you get more external rotation. Because you really have to use your shoulder to do that correctly. And Shelley, the other one was just thumb down, so it's a little more internal rotation. That wrist straight. I think that she just, from the surgeon standpoint, developed scar tissue much more quickly than an average person, and that's what happened. Because I think he even said he wished he would have put her in therapy that much sooner. They had given her stuff to do at home, which she did, but told her not to progress, to the next set of exercises until a certain point, and that was not quick enough for her. Her flexion, I think, was around 120, and I think the last we measured, she's about 160. Abduction was about the same, and that's improved. She's probably at 145 or so of abduction now. Her biggest limitations were rotations. Her external and internal rotation were at like 30, and now we've gotten her to 60 or 70 with a fair amount of stretching.
I tore my rotator cuff in 3 places, and I actually hurt it by, we moved into a new house, and I was taking out a shrub to replace, and I was digging and it just had all these roots under it, so I decided it was coming out from how I wanted, and I pulled it out, but I felt it go. I've always had I think my shoulders are my weak spot. They operated pretty soon after that, and I started coming to Toby to get the shoulder back into shape.
And Linda came for a long time with
religiously because I wanted it fixed. And I've got, I mean, I can say that.
Yeah. That was her last hard movement.
That was
the bra.
the bra. So yeah, so it's great. It was. So yeah, so the first thing we did is just a pulling through the water to get just the regular movement back. I could do this, but it hurt. Like I couldn't go behind me, and I couldn't lift all the way around. So it was hard, and I couldn't do like for any length of time either. I was still healing, so I had the little patches on it where the water couldn't get out to do it. And then it was this kind of stuff, but again, I couldn't do a lot of it.
So we did, in the beginning, I'd say for a good month, we didn't turn the jets on until
It was a while.
6 months.
Yes, the jets did not go on. We did all the,
But then she really powered through the jets.
yeah.
Oh yeah, so we did, so and backstroke, we did that, that was hard.
That was very hard.
Didn't like that. Did up and down.
Oh, yes.
Did forward. Really, really simplistic motions of the shoulder.
Right.
You know, we did some small circles.
We did small circles and I hated those.
Yeah. But I think in the beginning it was a lot, we did it just repetitive stroking. The first month or two, Linda, I would say, this is what we did, till she really got good range in that shoulder. But I'd say she had 70% deficit in range of motion. And she really had no strength, and it hurt. She was still definitely in the pain zone.
And part of the reason it hurt so much wasn't just the tendons, but
Remember that?
yes, I get
So
it.
she had a lot of cervical and upper thoracic,
Yeah.
mid-thoracic, so we used the the massages on her.
Yeah. Like we would work maybe.
Sometimes we do that for about half an hour.
Yes, but even if it wasn't half an hour, it was 15 minutes
Yeah.
at the end. So
Yeah. So that really helped. Same movements, but added a little more resistance. And we must use 2 legs.
That's right, because we wanted to
Balance.
Yeah. Well, at that point, I think we were starting to
So I don't think it was with both studios. Which is it? This was hard. This was hard for Linda to come all the way around and back strokes. That was very difficult. And to get back, to really get into internal rotation in order to come up and elevate.
we did a lot of
It was difficult.
this. It was just letting the
Flow you
lot
up.
of things float my arms.
Well, we did that with the chats and where we got very aggressive. And what are you doing now? Are you exercising?
Yeah, I walk like 3 miles a day.
Good. Doing a lot of arm swinging too.
Yep.
Okay, so then, and we just kept going through a progression of rings. We got, I think at one point you had a couple of rings on. She was strengthening, but it was still helping her to gain her range of motion as well. She still did not have full range of motion until the very end. It was probably the last, yeah, because I don't think it was 2 for you to put down. I'd say that the real strength building, she was building strength all along, but the real strength building with the jets came in the last 2 months, and she did not get.
But that last range was pretty good.
Yeah. So this is when she had a little bit more strength push. punching. A lot of underwater punching.
And we did a lot of this against the jets too.
Yeah, we'll do that. We'll redo everything. So you have to set the bars up, remember, because you got pushed back. Yeah, and a lot of pulling behind it. But Linda never worried. She never thought, okay, I can't do that because it's going to rip, or, you know, did I re-injure it? Why is that, why is that sore? Because a lot of people feel like that happens. So we use the fins on our hands.
These are trophies of torture. She basically used to get these so bad. They look easy and fun, but they're not.
I did try everything before I made her do it.
Yes, that's what she said. She never actually showed me the front.
I had acupuncture before I had my other daughter with acupuncture. Make sure that it wasn't too painful. And using the fins really helped Linda reach. And actually on her hands, it actually increased her range of motion because of the longer lever arm and the bigger the reach. She seemed to have a different stroke once she had the fins on. She really had to concentrate on getting the fin in the right way in the water.
Right.
I think you went this way and then this way. So that you turned in your shoulder. There you go. So she's just getting internal and external rotation of her shoulder through a consistent motion. Just to really rotate her shoulder and stop it. All right, we use the noodle. Push down. Yep. This is a good ab workout, so. I had to get her arms on there. She didn't get her arms onto the noodle to put it behind her to lift. She couldn't, the noodle just naturally floats her up to here, and she couldn't, it really hurt her to be up there.
Right. So basically I just up and down.
She really had, she stopped it from flowing.
I held it down.
Because she could not do what she's doing. Is that her well? So she really couldn't go as far as she's talking about.
No, I
she
just
held
put
it
it down. So it would go up and down.
So we had to move the bars around a lot. So you put one time you have the bar in the front and then put it behind you.
Right.
We were giving her some isometric asymmetric strength without something at first, and then he had to have one. So we have her trying to hold her arm against the jet at first, just to give her an asymmetric strengthening, try and hold herself in place. So there's a bar across the front, crosswise. And then we have her hold her arm back. And I think we were in front so we were closer.
We used both these and the middle.
Yeah. So then now she held it with her arm to the ball.
First it was just this.
And her arm, when she did this, was not behind her. She was out to the side. Yeah. Because she still wasn't, when she did this, John, she's not like she is now. She was out here and kind of down to compensate for the fact that she couldn't rotate without her fingers forward enough into internal rotation. So she externally rotate and go wide and hold them down. Instead, to get up here, she had to internally rotate and elevate. She couldn't do anything, but it pulled her hands. This forced her. She would come over and I'd push her hands closer together.
Right, like the hands were always like this.
She was out
like,
here, and it's like she'd have to push them together,
and I couldn't do it. So she had to do it for me.
And we tried to sometimes wrap the noodle. So again. And now she got stronger, and she lowered and raised it, and lowered and raised it. I think we're pretty creative, actually. Let's see what. Definitely not textbook. Art therapy. She really overused her left side a lot.
I'm Kevin Morris. I'm the head football trainer here at BYU. I've been at BYU for 7 years and then going into my 4th season as the head football trainer. We've had numerous shoulder injuries that we've used the pool with, whether they be anterior dislocation, posterior dislocation, post-surgical. Probably one that I'm thinking of was an acute AC joint sprain with some heavy contusion on the shoulder area. And one of the first things that we did after kind of our first 48 hours of controlling it with ice and stem and those type of things was to get them in and do some massage in the hot tub with the hose, and just letting them kind of work through the whole shoulder girdle area with that hose, and just trying to help them restore some of their range of motion. It reduces the pain, again, kind of going through the phases of therapy, decrease their pain, return their range of motion, and those type of things. And so with the shoulder, we started them off in there. Next thing we did was found they were very hesitant. It was a very mechanical pendulum motion that they were going through on land, and so first thing we did was put them in the treadmill pool with their arm down, just going through pendulums in the water. And again, it was amazing to see there was a mechanical effect on land where they get in there and it's much more smooth. They felt more comfortable, more supported, but if they're working through that range of motion, then we're progressing. So we worked through some pendulum type motions in there. I would have them actually, kneel. Depending upon their height, they might get on a step or somewhere else, and just kind of working flexion, abduction, kind of working in the plane of the scapula to try and get those range of motions back. Then what we started them doing was taking them basically through a shoulder girdle workout against just their body weight and the resistance of the water. Flexion, extension, abduction, adduction, internal and external rotation, horizontal adduction, abduction, and just having them go against the water. Then we incorporated them holding a buoy or a dumbbell, styrofoam dumbbell, going through the same motions in the water. So we add a little more resistance with the dumbbell. As they progress through that, and these would be, as long as there's no pain and they recover well, then we progress the next day to added resistance and things like that. Because our goal was to get this young man back out on the field throwing. Again, it was another quarterback. And so then we incorporated the side jet on the side, and then with the dumbbell, felt like we were actually getting some concentric as we were going against the jet on the side with the dumbbell in hand, working internal and external rotation, and then getting some eccentric as they resisted that force of the jet as it was coming against their hand, bringing it back in, and then we'd have them face and do the same thing, coming against the jet and then resisting it as it came back with that maximal resistance that you could get in there. And it was a great lead-in to, doing things out on land. That was kind of the way we incorporated the pool in there. And then, like I said, when we returned to function, tying a TheraBand to the handrail in the front, having them go back and just go through, some throwing motion so that they were coming through doing some almost PNF patterns, but with some tubing in the water, again, because they felt comfortable. They liked the water on there. They liked the warmth. Then as we did that, progressed back out to functional activities outside. Some manual things on the table, felt comfortable with them there, and then returned back out on the field to a throwing program out on the field. And so just come across your pec. One of the things, like I said, in the beginning phases, that somebody may just be trying to restore some pain-free range of motion, or just get a little water massage in there. And so we'll get them in the hot tub and just kind of massaging that area with the water. It tends to make a huge difference as far as their pain relief and again, just restoring some range of motion. So we'd start out this way and then progress into our exercises that we would do with the shoulder. On land or in the training room, they're very hesitant to do it. It seems very mechanical as they're working pendulums, but as we get them into the water, they feel some more support, and so they feel more at ease doing the pendulums in here. So I'm just going to have you do some pendulums in the water, just working small zeros, going to big zeros, and then you can start doing some patterns when X to X. Just doing real smooth. So as they're working these pendulums, they're actually getting some motion in the shoulder joint, which is going to help bathe that joint, nourish the joint, and also help with a quicker recovery. The longer that joint stays without motion, the longer it's going to take to rehab that. And so if we can get them in here working these types of range of motion, the better it's going to, faster it's going to work for us. Okay. So after we restore some of that basic motion in there, then we're going to start working specific muscle groups. So I want you to do an extension of the shoulder. Stand below 90 so we're not impinging anything, and that he's able to work in that. And we'll incorporate in some abduction, adduction. So he's coming across and out. So all the motions we would be doing, strengthening motions that we would be incorporating out on land, we're going to do in here. Okay, and then what we'll do is we'll even incorporate some horizontal abduction, adduction. So he's going to come across the chest. Now this one tends to be a little bit painful out on land, doing horizontal adduction with an AC separation, but in the water they tend to be able to do this without as much pain. I don't know if it's just because of the buoyancy or the reasoning behind it, but they actually say it feels a lot better doing it in land or in the water than they do on land. And so then we'll also do some rotator cuff, internal, external rotation with them. So I'm just working that in and out. Resistance with them. I like to use this yellow hand buoy. And so again, we'll start with internal, external rotation. So it's going to add some resistance to them as they're working this. We can also do our horizontal adduction, abduction. You can actually see the added resistance that they're using in there. And then doing our flexion extension. So working through this, through the water, makes it a nice fluid movement. You don't have any jerking and so what I want you to do is I turn on the jet here. I want you doing internal and external rotation against the jet. So you'll be facing that direction. So you see they're getting some concentric, eccentric work as he pulls that in against the jet. He's getting some concentric, and then as he comes back through, he's got to resist that. And so he's getting some eccentric work in there. This is a great way to work that range of motion. And like I said, you need to do it on yourself before you do it on your athlete, but you'll feel that shoulder girdle muscles working to do this. And so it's just another phase of resistance. I feel like if they can do this in the water, then we can progress them into the weight room, starting with pulleys. go ahead and try some horizontal adduction, abduction with that. And so he's coming across. And so that's really going to work that pec concentrically and eccentrically. And so we'll have them do like 3 sets of 15, 3 sets of 20 with each one of these. If that's too much, or if any of these are painful, we'll back off. And so kind of what I talked about too is you can take some TheraBand, working through the range of motion, throwing motion for quarterbacks, pitchers, something like that, using the TheraBand. And again, they feel a lot more comfortable. He's kind of standing right now. You can actually have him kind of kneel down in there. And there you go. And now just bring it across. Good. So you're getting more water in there. And so they can work through kind of that pitching or throwing range of motion while they're in there. And again, just helps incorporate that, hey, I can do this pain-free in here. I can do it pain-free out on land.
Get all the computer systems to do it. I think I've seen you here with that machine before. Yeah. So, do the schools let you use that machine or whatever?
AC joint sprains. I don't know a football team in the country that doesn't have one probably at least every week. And so, you know, again, we just go in and use these protocols to rehab back these athletes. And the 2 cases I spoke about both returned to play within a week, and you know, continued playing. And I'm just a big believer in hydrotherapy. I see the function of it and the way that it's allowed athletes to get back onto the field quicker and you know, functioning at their performance level where we need them to be. And so it really wasn't a question with him because I'd seen, you know, the results of it in the past. Almost kind of immediately. I mean, once we got through that 48-hour phase of making sure we were controlling the bleeding and some of the pain with modalities and ice and stuff in the training room. Again, like I said, it was dramatic, the change of doing pendulums inland, you know, where it's very mechanical because they're afraid to release these muscles up here. It's allowing them to get into the water and almost a just relaxed feeling, and them describing, oh, this feels so much better in the water than it does doing it standing off a table and letting it hang there. And so the results for range of motion and motion in the joint was very dramatic. You know, we document their rehab protocol as far as what exercises they do and what things that they've done for the day for our medical records. And I guess the thing that we look at is progress, noting their progress is where they're at on the field, when they're able to practice, when they're able to do those types of things. And so I guess that's the way I kind of chart the progress of it. So that first 48 to 72 hours, he felt his pain decreased, his range of motion increased. We got rid of a lot of the swelling and allowed us to progress into a functional program pretty quickly.